Good afternoon, and thank you for joining us for the second episode on the New York State Healthcare Worker Bonus Program. My name is Denis, and I'm the CEO of its Consulting Group. And I will be taking you through the updates. There have been 14 updates on the FAQ page of the New York State Healthcare Worker Bonus website. We will go through them and make sure that you understand what they mean to you and to your organization. As you already know, I'm going to make it real. And it's not going to be your standard webinar where they regurgitate whatever is out there. We're going to make it real. You're going to know exactly what to do and how to approach this vesting period and the attestation period, which actually runs out on October 31st. So 27 days. It's not a whole lot of time. So with that, let's go. New York State Healthcare Workers Bonus Program, HWB. Today, I'll be presenting with my good friend and colleague, Roy Breitenbach. He's a top lawyer on Long Island, and he's with the firm Harris Beach PLLC. Welcome once again. Disclaimer: copies of this presentation and other resources can be found on our website at hitcg.com. And this webinar presentation is for educational purposes only and cannot be used to contest any IRS, New York State, or any penalty and assessments. The information we are providing is based on our best understanding and knowledge as of October 4th, 2022. More information will be released on this program, which may be different from the information presented here. We will make every effort to answer questions at the end of the webinar, time permitting. Thank you again for attending. Summary of the latest 14 FAQ updates. Essentially, it is all about data security first and foremost. What does it mean? Well, you're dealing with social security numbers. And as you already know, there are plenty of laws protecting this type of information. So therefore, let's cover what it is that they are talking about. Yes, the state takes the necessary precautions when you provide the information on your employees, which contains the social security numbers. But what about you? What do you do to protect the employee's social security number? What happens with the file after you've uploaded it to the website? What happens with the attestations that you have had signed that contain the social security number of the employees? The very first thing that I have to tell you is you have to make sure that any information that contains social security number is properly stored, properly encrypted if electronically stored, and you have the means of making sure that other eyes cannot see that information without the proper key, the proper access. That is what you really need to read through the lines, right? In between the lines. When you're reading it, make sure that you are doing everything you can on your side to protect the social security number of your employees. Otherwise, you may find yourself having to respond to some authorities in regards to a breach or something to that effect. As we know, social security is prime, and when you have access to that information, you have to make sure that you protect it. And the second big deal about these updates is all about payment. As you already know, today is October 5th. And the first round of payments going out today. And pretty soon, employers will be receiving the lump sum, and they have to distribute it to their employees within 30 days. The key there is do not pay a bonus before you receive the funds. The guidance are very, very clear. Wait until you receive the funds before you distribute the bonuses. We will cover that in greater details in a little bit. And then the big one, as far as I'm concerned, DOH and OMIG cannot yet provide guidance if you make a mistake, underpayment or overpayment. What does that mean? Well, we're flying blind, but at some point we will have audits. Audits are coming. As I stated previously, when you see money being just put out there so fast, you can be sure that audits are coming to make sure that no wrongdoing is being done here. So these are the latest updates. With that, let's get through the core of the program. As you already know, there are 5 vesting periods through March 2024, and the maximum bonus per employee is $3,000, paid over 2 vesting periods, and the maximum that any one employee can get is $1,500 per vesting period. Now, the key differentiator here is that vesting period 1, which was in the past, October 1st through March 31st, when the program was first announced in August, has been taken care of, and the deadline was September 2nd. However, that deadline has been extended to match the current deadline of October 31st. So therefore, we are in vesting period number 2, attestation period number 2, and we can cover both vesting period 1 and vesting period 2. Now the deadline for both now becomes October 31st. So this is the one and only time employers will have the opportunity to do 2 attestations at once for any of their employees. So if you miss the opportunity on September 2nd, now you have to take advantage of the current window, which closes on October 31st. And then we'll have to wait another 6 months, because now we will be in May of 2023, and so forth and so on. Who is a qualified employer? Well, do you have an MMIS ID? Is it active? Do you have at least 1 employee working 20 hours or more? Do you bill for Medicaid services, whether it's Medicaid, Medicaid managed care, Medicaid as secondary, any form of Medicaid? And is your volume 20%? We will talk more about volume in a second. So that's the definition of a qualified employer. Now, who is a qualified employee? A qualified employee is a person providing face-to-face services, healthcare worker providing face-to-face services. Telehealth services, not very clear. However, if you watch the video for the first presentation, minute 24 exactly, on the FAQ website, you will notice that it says workers exclusively at non-patient buildings are not eligible. So dealing with telehealth services, you have to be careful. You have to work for a qualified employer, and you have to have an eligible title. And they go by the Bureau of Labor statistics. You have to map your title to the BLS worker's title. And that worker has to be continuously employed for a full vesting period. In our case, maybe 2. And the base salary cannot be more than $125,000 per year, or $62,500 per vesting period. Yes, direct contractors 1099 are eligible. They cannot be through an agency or the temp agency. Very slippery slope there, right? We always know that dealing with independent contractors, especially in New York State, is very slippery slope. So be very careful there. And obviously, more than 20 hours a week. So that's the definition of a qualified employee. Now, are contract staff eligible for the bonus? This is a key question here, and we will cover this in great details. So what are we talking about here? The concept of PEO MSO comes into play. These are organizations that, generally speaking, are the employer, and then they list out employees too. So in our world, you can have an MSO listing out staff to a medical practice, even a health system. Now, the real employer is the actual PEO, the actual MSO, and the employees are leased and working under the guidance of a practice, a hospital, or system. That employee is eligible. Now, there are a whole lot to do here in order to make sure that we stay within the guidelines. However, I wanted to make sure that it is covered. Tax treatment of the bonus from a payroll perspective. Payroll and FICA taxes will be reimbursed, and they are very clearly noted on the actual remittance that you will be receiving. New York State and city taxes are exempt. Federal taxes are not exempt. Other state taxes are not exempt. Employees living in Connecticut, in New Jersey, in Pennsylvania, for example. Obviously, we are not tax attorneys or CPAs. So consult your tax advisor. And OMIG audits. 6 years following the last payment. That means if you receive payment, you have to keep your records for 6 consecutive years in order for you to know that you will pass an audit. And the time to do this is right now, today. I've seen this so many times. I've been doing this since 2009 at the very beginning of the meaningful use and all the way through now. I've seen so many cases where people have to pay the money back because they don't have records. You're not going to be asked for anything for the next maybe year, 2 years, 3 years. And then all of a sudden you get an audit request. Will you have your documents in order? That is paramount. The time to get your documents in order is today. Now, let's talk OMIG audit. So, probably some of you, most of you have seen this already. You receive an email and congratulations, you have a bonus coming. And there is a little file that is attached to this, and it's next to payment made. It says download. You download that file, it gives you the information in details. Who is qualified and for what amount. That is the amount you're going to have to pay to that employee. Again, that file, you download it, it does contain the employee's social security number. Make sure that you protect that file. Make sure that that file, if it is going to be in electronic format, is encrypted. And very few people have access to the key. That's what you need to do with a file that contains social security number. Now, the guidance here is very straightforward. You are given the exact amount to pay to the employee. Nothing can be taken away from it. Yes, it probably will cost you some administrative fees to have this program done. You cannot deduct any of those from the employee. The guidance is given to you, and it is the rule that you have to pay the employee the full amount of the bonus they qualified for. At the time of an audit, that's what you will have to do. You will have to prove that the money came in and it was distributed exactly as per this downloaded file, and the employee received the full amount. Therefore, the guidance from our company to all of our clients is to run a separate payroll so that it's easy for you later on when the audit comes to prove that you followed the guidance to the letter. More to come. So you have to document your 20% patient value for each vesting period. So there are basically 3 ways of doing this. In the world of meaningful use, is very clearly defined. Patient volume was always based on the actual visits. It's not the number of patients, but it's the number of visits. So if you have 100 visits during the vesting period and 20 visits were Medicaid, whether it's direct Medicaid, Medicaid managed care, Medicaid as secondary, you met the 20%. This is very clear and it has been used so many times. That's our recommendation, that you use the patient volume. Other ways of doing this, clearly, you could use patients, period. If you had 100 patients seen during the period and 20 patients were Medicaid patients, regardless of the form, then you would meet the 20%. Or you could income. You received $100 during the 6 months period and $20 were paid by Medicaid of any form, then you would meet 20%. This problem here is that we are not given specific guidance. The FAQs clearly state that you make the decision which form you want to adopt, which formula you want to adopt in order for you to prove the 20% Medicaid patient volume. Our recommendation is clearly to do what has been done and that has sustained all the audits that we've done over the last 10 years. patient visits. It's in your EHR, it's clearly documented, and you don't have any gray area. Second, payroll records. You have to have your payroll records clear for each employee, covering the entire vesting period. You have to have this preferably in Excel format so that you can easily manipulate this. You will need your payroll records in case of an audit. Treatment of employees making around $125K per annum. If you make 125 plus, you are automatically disqualified for the bonus. However, a year is composed of 2 vesting periods. So therefore, we have to look at the actual earnings per vesting period. So an employee may end up making over $125,000 a year. However, in a specific vesting period, they may be under the 62.5. Let's say that the employee receives a raise and employee became more valuable to you, and you gave that employee a raise, and that happened in the second vesting period. So that employee may be eligible in the first vesting period. So be careful there. And collection of employee attestations and preservation. Again, the whole business of data security. Those attestations contain employees' social security number. Our advice to our clients is to do that in a manner that is trackable and that is encrypted. In a manner that is trackable and encrypted. The reason that you want it to be trackable is because you have to show that you've made every attempt to get an employee who is qualified to sign an attestation. Whether the employee refuses, whether the employee delayed, whatever, you need to be able to document that. In case of an audit and you are accused of having missed someone, then you have the record to show that you've made the attempts necessary to have met the actual guidelines. However, this is what happened with the particular employee. Extremely important. And preservation, electronic format, data security, encrypt those files. They contain employee social security numbers. Again, use a system that would provide these capabilities to you, especially in case of large employers who have a lot of employees and they are all over the place. That is the best way to handle it electronically. However, make sure that the system is able to encrypt the communication. It may not be encrypted outbound, it's fine, but it certainly needs to be encrypted inbound when the employee signs that document and fills out that document with their social security number. Terminated employees, the guidance are very, very clear now. So now, past employees, we're dealing with a current situation, very different from the last September, where we were dealing with a situation when the vesting period was in the past. We're dealing with a current situation. So the guidance is very clear. We'll cover that in a minute. Obviously, any employee who is eligible, whether the employee is still with you or not, the employee deserves to receive the actual bonus. Documentation, documentation, documentation. You need to document the job functions regardless of the job titles. The job function regardless of the job title. So in a small office, an office manager may be the receptionist one day, maybe the phlebotomist another day, maybe in any other client-facing situation because they are qualified to do so. And it's a small office. So look at the job functions regardless of the job title and make sure that your documentation is in order, because when you have an audit, you will need that type of documentation, especially when it comes to telehealth workers. Remember, if they were in a client-facing environment and now they are in an environment that is not client-facing but providing the same services, they are eligible. as opposed to some people that are far away in the corporate park never had an opportunity before COVID to really be providing face-to-face services. So it's a gray area. You have to have clear definitions, dig into it, look for help, make sure that you get this one right. Again, it's the responsibility of the employer to make sure that coordination among multiple employers does take place. If your staff has multiple jobs, you need to find out. And if they are working more hours elsewhere than they are with you, therefore, you make sure that the other employer fills the attestation on their behalf and gets them the maximum bonus that they qualify for. The intent is to pay the employees the maximum bonus that they qualify for. So make sure that all of these are covered while you're going through your process so that you are fully ready when you have an OMIG audit. And as I said before, I am guaranteeing you they are coming. Obviously, there is more to it than that. Now, let's take a look at some of the complex cases. Professional Employment Organization, MSOs, former employers, multiple businesses at the same location, again, telehealth workers. We have to make sure that when it comes to PEOs and MSOs, they are leasing the employees to the businesses, and the businesses are the ones directing the employees. Essentially, the PEOs and the MSOs are the employer. That means they have the payroll records for the most part. However, the employee is working under the guidance of the practice, the hospital, or whichever location where they're providing the face-to-face service. We covered the former employees already, but we will come to that in a moment in greater details. Another area of complexity would be multiple businesses at the same location. And one business may be taking Medicaid patients, another business may not be taking Medicaid patients. However, do you have the same staff taking care of both sides of the house? We have to be very clear about that. And telehealth workers, we covered that in great details before. We have to be very clear that we cover these situations very, very carefully. And you must get this right. The right bonus must go to the right people. No one may be missed, neglected, or refused if they qualify. If an employee is qualified, you have to pay the bonus. Otherwise, you may face a fine of up to $1,000 per incident. What do we mean by getting it right? So this came straight from the FAQs on the state's website. In most instances, after an employee is terminated, that employee may still be eligible. In most instances, after the employee resigns, that employee may be eligible, but not pay attention to the last two where the employee is ineligible. The employee vested, but the employee quits the employer prior to the bonus being claimed. That means the attestation being submitted. The employee vested was employed at the time of the claim, but the employee left before the employee receives the bonus payment. These are the two circumstances that you really have to be mindful and aware of. Otherwise, most of the time, the employee would be eligible. Best practices. Define and define and define. Whatever it is that you are not 100% sure matches the program guidelines, make sure that you get the clarification and make sure that you get it in writing. If it is not on the FAQ, make sure to contact the state and get it in writing. An email is good. And on your side, make sure that everything is well defined and it is documented. It is in writing. You will need those during an audit. Make sure that your titles, your job titles, they match with the Bureau of Labor and Stats title. New York State provides the list that came straight out of the Bureau of Labor and Statistics. Make sure that your job definition, they match. And again, the best thing that you can do is use your judgment and experience. For example, if you have had meaningful use experience, use that, or any other guidance, any other program that you've done in the past. Because the information is being updated as we go. And obviously, we cannot wait until everything is defined before we start to do anything. If you did not have confidence the first time and you did not submit attestations last September, you don't have a whole lot of choices. This time around, you will have to submit attestation because, again, there's no guidance that they will give you another chance. You have to do this. As I stated before, trackable employee attestation process. Show how many times the employee has been contacted without any answer. Add other questions to the attestation so as to make sure that you're not, leaving any stone unturned. As the employees, do you have another employer in New York State? If yes, how many hours do you work elsewhere? Have you received the HWB bonus elsewhere? Ask those questions. Dig. And make sure that you're not leaving any stone unturned, right? And I stated before, your best tips is to run a separate payroll. Use a separate payroll code. That gives you an opportunity to have an easy-to-run report. That's what you will need 2, 3, 5, 6 years down the road when they ask you to prove anything. You make sure that you make your life easy. You set up your structure today in a manner that will support you year after year in audits. Thank you very much. Now that has completed my part, my good friend and partner, Roy Breitenbach, is going to be coming on next and will do the rest of this presentation. Thank you.
Henry has given you a very good overview of the entire process here, right? And a couple of things that he said are very important from a legal perspective. The first thing is document everything, right? This program was rolled out very, very quickly. There are not a lot of regulations associated with it yet. The law was passed quickly as part of the governor's budget, and so there's a lot of vagueness. And when there's a lot of vagueness, it means that when the auditors come, whether it be 2, 3, 4, 5, 6 years from now, there's going to be a lot of disputes and a lot of uncertainties and potentially a lot of gotcha moments. So there's a couple of things I really want to emphasize. The first, what I consider to be the potential pressure points with all of this, is documenting that, in fact, 20% of your volume is Medicaid, right? Now, Henry has given you the recommendation, and I wholeheartedly agree with it, that you should follow the same procedure as you do for meaningful use, because it's the easiest way to do it. So when you do that, keep a copy of your documentation. Be able to recreate it if you're ever audited. Keep it in a file and establish it. Now, you also might want to do the calculation the other two ways as well, right? And the other two ways are simply by number of patients or simply by the amount of reimbursement. And the reason why we would suggest doing the calculations all three ways and keeping the documentation for that is that in the case later on down the line, there's some type of a new interpretation or the government decides, notwithstanding the fact that they said they're not going to take sides as to how to do it, you have backup. It's a belt and suspenders. You could say, well, if there's a fight over some way to do it one way, you can establish it the other way. My suspicion is for many practices, you would probably meet the 20% thresholds under all three tests. So why don't you document yourself under all three tests in case there's a problem on down the line, you're covered. The second pressure point of what I'll call it is the issue of of contracted employees. And that comes up with PEOs, MSOs, and I'll call them independent contractors, okay? The concept behind this, although it's not entirely clear, but if you can kind of glean from the statute and you can take it and look at what the Department of Health has said about it on all its various websites and guidelines and everything, is that a truly leased employee is somebody who is eligible for the bonus. So if you have a relationship, for example, with the PEO, where technically the PEO is the employer of your employee, but you're now leasing that employee, and you control all the incidents of employment. You give them their, you make the determination when they work, what their schedule is, their job responsibilities. You review them. You do all of that, and it's just the PEO for purposes of benefit and payroll. Well, then you're a leased employee. Not only can you give them the bonus, you're obligated under the law to give them the bonus. So you have to treat them as your employee, okay? So, what we think you have to do in that circumstance is the best way to take care of the situation to eliminate any doubt is to make sure it is clear in your PEO contract that employee is your employee for all purposes other than the benefits and the employment, right? And of course, obviously, if you have this relationship, whether or not you get it right means a significant amount of money for you, particularly if you have a lot of employees. So we would recommend that you actually have a lawyer look at that agreement to make sure that it's properly documented. And if it's not, have a addendum to the agreement signed by both parties that makes it clear, okay? Now, the PEO relationship, I think, is the easiest one of them because it's clear in most PEO relationships that the employee is really the employee of the actual business and not of the PEO, right, in almost all cases. So it's relatively easy. The other thing you have to remember is even though you're not the employee at law in this circumstance, right, the PEO is, you have to keep the attestation clause, the attestation documentation, and you're responsible for making sure that the bonus gets paid, right? It may come out, so you have that obligation. And the money is going to come to you, right? So you're then going to have it documented as to how you paid it. They're not going to send that money to the PEO. They're going to send the money to you because you're the Medicaid entity, right? So you have to make sure that you follow the proper paper trail and flow in that circumstance as well. Now, when we get down to the level of an MCO, it's a little bit more complicated, right? Because in MCO, there are certain circumstances where you may also provide some employment functions for the MSO in addition to the actual practice. So again, we want to make it crystal clear that this is a situation where the MSO is actually just the entity that's employing the frontline worker, but for all intents and purposes, their employment is controlled by, they get their schedule by, and they're a permanent employee of the practice, right, of the Medicaid entity. And that should be documented in the MSO contract. And again, if that's your relationship, you need to have a lawyer look at that contract to make sure it complies with the terms, to make sure it's crystal clear, because you don't want to face an OMIG audit on this issue later on down the line. So we urge you to do that, right? And make sure that everything is documented. Another thing to remember is that an independent contractor relationship, a lot of practices may have a situation where they have a physical therapist, an occupational therapist, or somebody else who's not their employee but works on an independent contractor agreement, that person is still an eligible employee for purposes of the bonus if they meet all the other tests. So you have to be careful about that, right? Just because you consider them an independent contractor and they have an independent contractor agreement doesn't mean that they're not an employee for purposes of this bonus. So that's something that you have to be very careful about. The other thing I will say is that you have to be careful, and where this is a vague area is, you may have engaged a temporary staffing agency to provide you workers, right? And the relationship with that temporary staffing agency may start out where these are truly temporary employees, where they come in and out on a short period of time. They may take other assignments. Their per diems are locum tenens. But because of the pandemic and what's happened after the pandemic, even though they're employees of the temporary or staffing agency, they, for all intents and purposes, have been your employees. They're on long-term, 6-month, year assignments. You direct all their work. You set their schedule, and they're just still, though, technically employees of the staffing agency. And the staffing agency in that case is essentially just acting almost as a PEO. In that type of situation, you really have to look as to whether or not it's like a PEO and you're the entity responsible for paying the bonus and they're entitled to a bonus. And that's something, again, that you should have a lawyer look at, you should analyze, because that's a potential situation of an exposure that you might have. So we see those as kind of the biggest potential pressure points. Another pressure point is actual payment, okay? Making sure that when you get the money in, it's going to all employees to whom it's entitled to, right? You want to make sure you've tracked everybody down and you've documented that the money has gotten there. Because if there's one thing that OMLI is going to look at first, is situations where providers have gotten the money from the state but haven't turned around and provided that money to to the entities with whom they're supposed to, the employees. So that's a very important point that we really think you have to be careful about. Also, you need to track down every employee who's potentially eligible and make sure that you have the attestation forms for there. If you go on the website, it sets forth a procedure that you should follow if an employee you believe is eligible, but he or she refuses to sign the attestation clause. You're supposed to document that, and if you believe that they're entitled to the bonus, you can put in a claim for them, but you need to document that.
So with that, we will try to get all this information on the website in a short order and everywhere we can on social media. And obviously you have our information. You can always, reach out to us. Thank you so much, everyone, for attending. Much appreciated. And if you have any question that was not answered, please just reach out via email and we will get back to you as soon as possible.